Hi, and welcome to IMG1011 Musculoskeletal Sonography. This is going to be a course delivered over 15 weeks. There are 2 hours per week in this course. 1 hour will be online, set online with different activities to do, and 1 hour will be set in the classroom. This is our introductory unit. I'd like to give you a bit of an overview. We've gone over the CSI in class, and we'll leave it at that. You can locate that CSI or course section information with all the information and your schedule, what evaluation components will be in the program or in this course. They're available on Blackboard under course information. We're going to talk about why we do MSK ultrasound and why do we do this instead of something else, let's say. And we're also going to talk about equipment considerations today. So what type of equipment, what kind of things do you need to actually perform musculoskeletal ultrasound? So let's talk about why ultrasound. So ultrasound, as we know, is a relatively inexpensive modality. You buy a machine, you plug it in, it pays for itself. It's a money-making machine. You have to pay a sonographer, or sometimes just a radiologist does the test. But compared to the cost of an MRI or a CT to that of an ultrasound, the MRI costs will be considerably higher. You can pay up to $900 for just a knee or a wrist or an ankle in some places in Canada, in private clinics. And you can also pay for combination MRIs, let's say a hand and wrist or a foot and ankle. You can pay upwards of $1,600. So the cost of an ultrasound in comparison to this would be about $500 in Canadian funds. Even though we don't pay this out of pocket in a hospital setting, the costs are still there, and it's not to say that they aren't there. Another reason that we do ultrasound is that it's relatively fast. So you can take maybe a 30-minute booking, get an ultrasound done, diagnose a tear in the shoulder, let's say. Within that time, it's reported and it's already sent back to emergency. It's pretty fast, and it's pretty effective too, because questions get answered fast. They want to know something really fast. Let's say it's in emergent situations. Then treatment can happen fast. And again, there's a domino effect on the health system. So the first course of action would be ultrasound if it's available in an emergency type setting or an ultrasound setting. And of course, the one good thing about ultrasound too is that it uses non-ionizing radiation. And so that should be definitely considered, let's say, a young person before going right away to, let's say, a CT, where you have a considerable amount more of radiation, ionizing radiation. It's great for soft tissues and the bony cortex. So you can easily see layers of soft tissues up to the bony cortex. And it's very sensitive to see small undisplaced fractures on the cortex, for example, the rib. So if you look at this rib here, you can appreciate this rib from here to here and here to here. You have this step deformity and a jaggedy sort of edge here. So this is a nice little rib fracture. You can see muscle on top of here. So why ultrasound? Well, it's great for soft tissues and bony cortex. It's fast, non-ionizing radiation. It's effective, and it's inexpensive. So why not? And another great thing is that it's dynamic. So no other modality can boast both the use of non-ionizing radiation with real-time imaging. We can readily see what's happening and often can recreate the cause of a certain pain or dysfunction. Let's say a patient's moving their arm or abducting the arm or adducting the arm, whichever, and you can actually watch and see if a patient is, let's say, something's getting caught or there's a displacement of tissues that is causing a pain. So next important thing, what to pack. So when you're doing MSK ultrasound, it's really important to have the right tools, or else you're going to make your life miserable. So what to pack? In your survival kit, we call it a survival kit, you're going to need a high-end ultrasound unit, and you're going to need one with features. Hopefully you have features like tissue harmonic imaging, spatial compound imaging, multiple beam capability, like the Sono-CT, high-frequency transducers, extended field of view or panoramic imaging capabilities, so that helps you get a better overview of things. High-frequency transducers come in all shapes and forms. You have here the popular hockey stick. We call it the hockey stick because of the shape. It's got a smaller footprint, and it's good for small areas. Now, these transducers used to only come so far in the frequency area, and they didn't have any spatial compound imaging, but they've come a long way, so I wouldn't be surprised if now we have some that are out there that do this type of thing. It will make it a better image ultimately. Then we have the popular linear high frequency. This is probably the one you'll use the most in imaging in MSK. Because of the shape of the probe tube, it sends the sound waves in perpendicular to a lot of things. You have to do a lot of rocking and twisting of the probe to kind of get different angles on it, but it does work really well. And then we have the curved. That's for seeing deeper into the tissues or into a joint, and for curved areas it's helpful as well. So when we talk about MSK, we're going to talk about sagittal. We're not going to talk about sagittal and transverse anymore. We're going to talk about long axis and short axis. So long axis and short axis are the terms that we're going to use during MSK. Because of the way muscles are represented in the body, they're not always deemed as sag and trans, and it gets confusing after a while. So long axis and short axis are the accepted terminology. Here we have an example of transducer positioning. So an example of long axis up here in A, where you can see that the probe is positioned long axis or along the length of the spaghetti. And then turning the probe 45 or 90 degrees, you can see that we're cutting the spaghetti at 90 degrees, and we have a much better representation of a short axis view here. So this is cutting the fibers or the spaghetti at a short axis. You can see here on C, the long axis representation. You can see the fibers. And then short axis again here. Different things we can do with transducers. We can manipulate them in different ways to obtain a better image, as you know, with abdominal work and guiding work right now. But we can also do this, and it's actually very dependent on this for getting great images in MSK. And this is one of the reasons it is so operator dependent. It's kind of teaching yourself how to manipulate the probe so that you're optimizing the image. So we have here at the top in A, we have, we're actually heeling the probe. So we're using the heel of the probe. In B, we're using the toe. We're towing the probe. On C, we're sweeping up and down or rocking, sweep rocking. D, we're actually just sweeping. In E, we're rotating the probe, a very important tool in anything you scan, but really important in MSK, to be able to rotate that probe. And then holding the probe very steady, keeping in F, holding it down with one finger, stabilizing. And in G, we have that nice thick gel layer. So thick gel is a must in MSK, as you can see here. And that kind of helps us to rock the probe better and to actually get a better angle on the probe or on the tendon. So besides that, what do we need? We need books. We need patience. We need more books, and we need charts. Although it doesn't say charts here, I've covered it. Charts are very important. You can actually carry some in your pocket with you in your lab coat. It makes life a lot easier. Recommended books to have on hand in your MSK life are the ultrasound textbook you have right now by John Jacobson, as well as the Atlas of Human Anatomy with Dr. Frank Netter. And that's the Bible, basically. You go to that book before you go into the room. You study, you look where things are inserting, and then you go in to scan your patient. There's a lot of really excellent muscle charts out there. They probably sell some in the store here at Algonquin. You can have a look. And they're not very expensive. Then there's sponges and wedges, stools, small tables to let your patients rest their limbs on while scanning. So it's much more comfortable for you to scan if your patient is comfortable. So take the time to find a small table for them to rest their hand or arm on before you get comfortable to scan. So trust me, it's worth it. And don't forget your cable brace. All right, so next week what we're going to do is we're going to go over understanding muscles and tendons in sonography. We're also going to discuss important artifacts in MSK. And for your online hybrid component, you're going to go into the expert consult, thinkling.com, and you're going to register your textbook online. I've given you the URL here. Then you're going to answer questions to the quiz that I've posted on Blackboard, and you're going to use your notes, your PowerPoint, and textbook, Chapter 1, Equipment Considerations and Image Formation, and Scanning Techniques. And I'll be giving you some questions on that. Thank you.